A warning tonight from health experts about a potentially deadly flu season on top of the pandemic. Dr. Stephen Thomas is an infectious disease expert. He is joining us now. Welcome. Thanks for taking some time on your Sunday to join us tonight.
Yeah, thanks for having me.
So break it down for us. When is flu season? When should you get the shot? And how long does it last?
Okay, so flu season in the United States can start around November. It can go to as late as May, but the peak is usually December, January, and February. And so we like people to start getting vaccinated against flu in September and be complete by the end of October so they can face that peak part of the season. The flu vaccines last for about a single season. That's why we have to get new vaccines every year.
So, and then let's say you do get sick with the flu. It has a lot of the same symptoms as COVID. Is there a way to know which one you have without getting tested?
Unfortunately, there is not. So clinically, you really can't distinguish the early phases of influenza from the early phases of COVID. So if you have any symptoms, you really need to isolate yourself from others, get tested, and they'll be able to tell you whether you have flu or you have COVID or you have some other virus that circulates in our fall and winter.
And how far apart should you get the flu and the COVID vaccines? Can you take them together? Are there side effects when you take them both together?
Yeah, so the good news there is that, yes, in fact, you can get both vaccines at the same time, same clinic visit. We just recommend that you get them in different locations. We co-administer lots of vaccines, and we co-administer a lot of vaccines with flu. And so really, there's not an additive effect in terms of side effects. It's just the individual side effects that each vaccine has.
And there already is so much fatigue, right, with the push for vaccinations when it comes to COVID. It's been all consuming. Do you think people are going to take flu shots seriously?
Well, I think people who understand the public health benefit of vaccination are going to get a flu shot, and the people who get flu shots every year are going to line up to get a flu shot. Flu, we have forgotten, but flu kills tens of thousands of Americans every single year, and it can be a very severe illness, especially in certain vulnerable populations. So my hope is that even though people may be fatigued, my hope is that they'll still roll up their sleeves to get vaccinated against flu, just like they have against COVID.
And so obviously, as a health expert and a public health expert, that's your hope. But I think flu season dipped last year, right? Because people were social distancing, they were practicing good hygiene. What do you think is going to come this year in terms of the flu?
Right. So, yeah, we had this remarkable, this was an international phenomenon that flu and even RSV almost completely went away for the season. But remember, back then, we weren't dealing with Delta, number one. And number two, people were very strictly applying these non-pharmaceutical interventions. So like you mentioned, wearing a mask, only staying within their pod, social and physical distancing, washing their hands all the time, certain restaurants and schools and everything else, right? People were not gathering. That's very, very different right now. So I expect that we're going to see more flu activity than we did last year, but maybe not as much as we've seen pre-COVID.
What happens if you get the flu and COVID?
Yeah, so that's a very bad combination, especially in older people and people that have underlying medical problems. It can be very severe.
All right, Dr. Thomas, thank you for bringing us more important information about another vaccine. We appreciate your time tonight.
Thank you.